what do you make of all this? I mean, the point is, yes, a lot of people are catching Omicron. And despite the best efforts of Chris Whitty, the Prime Minister, the sage soothsayers, they now have to admit this is a pretty meek and mild variant that doesn't do you much harm. So first of all, we've got a government that is frantically trying to protect the nation from catching the sniffles for a couple of days. It's like, thanks very much, Boris, but we can handle that ourselves. And secondly, everybody's having to test and self-isolate, and that has caused the crisis. So now we've got COVID chaos awaiting commuters. Trains are not so many trains have been cancelled because that Victoria Station had to close. We've got rubbish bins and recycling containers across the country overflowing onto streets. We've got several councils have had to force their services to be suspended amid massive staff shortages, and 1 in 10 NHS employees are now off sick, although they're probably not off sick, they're off well, but they tested positive. This is crazy.
Exactly, and it goes back to this oxymoron that the government keeps churning out about learning to live with COVID. Since when is making 100,000 critical care workers perform daily lateral flow tests learning to live with COVID? It makes no sense, and it's continuing this absolute farce of the mass testing of healthy, otherwise asymptomatic people. It just doesn't make sense. If you are well enough, you feel well enough that you don't know if you have the virus or not, I don't believe that's an excuse to go off work. This isn't because of COVID. This is because of our approach to COVID that will cause more shortages, more disruption. And I struggle to understand how the government doesn't know this by now. If you're handing out more mass tests, you're going to have a higher prevalence of false positives, and you're going to have a higher prevalence of people that are positive but literally have a cold or flu. Since when do we isolate when people have the cold or flu? What we should be doing is people that have visible symptoms, they should be testing themselves, and they should be isolating themselves where appropriate. Those who are asymptomatic, I don't really believe there needs to be this push for testing. Me personally, I recently had Omicron, I think it was. Because
I know you did, because you were going to come on our show, weren't you? But you had to cry off.
Yeah, exactly. For me, I had Omicron, I think, and for me, it was more or less a cold. I was too tired to do much work for about 1 or 2 days. But the key for me is I tested myself because on the Saturday, I woke up feeling like crap. I had a stuffy nose, I was sneezing, I was coughing. Common sense says take a test. Why can't we just use that common sense going forward?
Yeah, I don't want to decry the very nature of taking a test. If you feel like you got a cold and you're going to go in amongst your workmates or anything like that, or out and about among crowds, then yes, that's the time to test yourself. But we don't test ourselves every day to see if we've got a cold or the flu or a stomach ache. But we're testing like crazy for this one condition. And frankly, because it's Omicron, as you said, I mean, I'm sure you didn't feel that well, but it was not that bad. It's a couple of days of sniffles. You can't sort of say, oh, you've got this fairly mild virus, take a week off, stay at home. That's what's causing this crisis. We are causing chaos.
Continuing it.
Yeah.
We're causing chaos, and it seems at the moment we're doing it willingly. You've got Sajid Javid, the health minister, saying, we need to learn to live with COVID. And then you've got the education minister, Nadine Zahawi, announcing that we're going to be masking kids in schools, despite very little evidence that this is actually going to do anything to stop the spread. And I remember I've said on here quite a few times talking with you that this new variant might actually spell the end of this pandemic. And some scientists have actually come forward and said the same thing. Because it's so mild, because it's leading to far less hospitalizations and far less deaths, what we should be doing is allowing a natural degree of herd immunity to build up in the population towards this particular variant, and then we can move on. It doesn't make sense to be shielding people, especially when it's very, very unlikely that these people are going to be hospitalized or are going to die. If you look at the statistics, cases have shot up, but in terms of ICU, intensive care admissions, in terms of deaths, they've largely plateaued, and in some cases reduced slightly in terms of the rate of deaths and the rate of people in ICU. So it's not a crisis that we're in right now. And I don't understand why Chris Whitty is so hell-bent on convincing people that they need to be terrified of this variant when all of the evidence suggests that we need to be doing the opposite. And that's moving on.
I agree. And we need an explanation from Chris Whitty as to why he said a couple of weeks ago, when we're all looking at South Africa, where the founder, if you like, of the Omicron variant, Dr. Angelique Coetzee, said, this seems like a mild form of the coronavirus. This seems like good news. It's certainly not hospitalizing many people. It's certainly not killing many people. We think this is a good development. Chris Whitty stood up and told this nation, the British nation, we don't know much about Omicron, but everything we do know is bad. Why? I want an explanation for that, because that was simply not true. Everything we knew, we didn't know much about the Omicron variant, fair enough, but everything we did know about it was good.
Exactly. So why do it? And even the same for Professor Neil Ferguson, who we know now has been wrong at every turn. He was predicting 3,000 Omicron deaths a day in the peak in January, and claimed that the Omicron variant was no less severe than Delta. That turned out to be completely wrong. So why are we basing restrictions and the continuation of our lives and our economy on the predictions of people that are, quite frankly, always wrong? It literally doesn't make any sense.
Sage warned us in mid-December that by the end of December there could be 1 million cases of Omicron a day. They were woefully short on that, and they also said that by mid-January there might be 6,000 deaths a day. At the current average is around about 100 deaths a day, so it doesn't look like their second prediction is going to come off either. We've got to stop this. We've got to get away from listening to these people and their catastrophizing predictions.
And that's why, I've been very, very, very critical of Boris, and even in relation to this testing he's announced. I think it's prolonging the pandemic, really, doing that. However, he does seem to have stood his ground with regards to not announcing any more restrictions. And there was a lot of pressure on him, both within the media and other, media and Twitter scientists online who sell masks to, I don't know why they do that, but there you go. Yeah. He was facing a lot of pressure, and he stood his ground. And one thing I liked about the press conference today, I don't want to be a negative Nancy, is he was actually repeatedly highlighting the damages of lockdown to people's mental health and to the economy. And that's why, as he said, the data just doesn't show at the moment that we need any more restrictions. And I think that was absolutely the right decision.
If anything, the statistics are going in the right direction. They're certainly plateauing, and it looks as if Omicron is going to form the same pattern as it did in South Africa, an explosion of people catching it, the realization it isn't very serious, it's a couple of days sniffles, a massive number of cases, very low hospitalization, even lower deaths, and then it just peters out. And so far it looks as if, despite what Chris Whitty told us, that you couldn't compare Britain to South Africa, it looks as if you can, and that's the way it's going to go. Going back to what you said about school kids, now I think it's disgraceful that school kids have to wear masks, or they've been told when they go back to school they'll have to wear masks. But the good news is so many teachers are off sick. Looks like the kids won't have to go back to school after all. I mean, the madness continues, doesn't it?
And it's just anxiety inducing, and it's misery inducing, especially for all of those kids that rely on being able to leave their homes, that rely on being able to go to school, that rely on teachers there. And this isn't just about education, it's also about the spate of child abuse cases that we've seen rise throughout lockdown. We've heard about very high profile child abuse cases, for example, Arthur Levincho Hughes. He isn't the only person that has suffered with regards to lockdowns, with regards to these restrictions and taking away children's education. And the government can say all they want about, using masks and using testing to keep schools open. I don't believe that actually does keep schools open. What it does do is keep the fear going and make it so that teachers have to isolate, children have to isolate, so much so that some schools basically having whole year groups off because of the amount of people testing positive. I don't see how that is keeping schools open. And the same could be said, I'm going to pivot slightly here, I'm not going to go too off topic, but the same could be said about vaccine passports. Remember, we were told that we needed vaccine passports to keep restaurants and pubs open. Yeah, in places like Wales, they had the vaccine passports, yet closed the nightclubs anyway.
Yeah, and by the way, they're talking of the Kim Jong Drakeford's Wales and Nicola Killjoy, Queen of Scotland's country. So Nicola Sturgeon brought in all these draconian measures, diktats, rules, regulations, left, right, and centre. Wrecked Christmas for the poor, long-suffering Scots. Wrecked Hogmanay, big thing for them. She wrecked both of those. So we've got a lockdown. And yesterday she had the highest number of COVID cases in Scotland's history. So everything she has done and everything Drakeford has done have not worked. They just have not worked. And so we know now from Wales and Scotland that COVID passports, health passports, that they want you to show now in England for football matches and the like, they don't work. So why do they bring them in England?
They don't work. Even in Northern Ireland, their cases are up by 91%. And in Wales, it's a similar level, incomparable to England. And we're the country that has had very, very minimal restrictions. And you could even say that's because we've recently introduced vaccine passports for large events, because there's no evidence that actually has any impact on cases. So what we've demonstrated is, and do you know what? I've said this quite a few times. I'm actually glad that Northern Ireland, that Scotland, that Wales have gone full zero COVID mad, because what they've actually demonstrated is these kinds of restrictions don't work. So when people like me have been saying these restrictions don't work, all they do is ruin people's lives, I'm called irresponsible, I'm called all of the names under the sun. But now we have the actual evidence that ruining people's lives in this way has no impact on case numbers. So what we need to do is stop focusing on cases and testing everyone, and we actually need to look at hospitalizations, at ICU numbers and deaths. That is what we need to look at. And in that scenario, we're in a good place.
I agree. And, fair play to Boris. I know he was sort of bullied into his new bold stance, not bringing in more regulations, by his courageous Tory backbenchers who said, you do that and your job's on the line. I know he was bullied into it, but fair play to him. He stayed strong and he's been vindicated. And as you implied just then, Dominique, Mark Drakeford and Nicola Sturgeon look ridiculous. They look ridiculous and they deserve it.
Exactly, because what they've been trying to do, they've been trying to mirror the approach that a lot of European countries have taken with regards to this virus, because that Nicola Sturgeon loves the European Union, as does Mark Drakeford. And what they've tried to do, they've tried to copy the likes of Germany, they've tried to copy the likes of France and all of those draconian measures that are being implemented there. And they've tried to embarrass England. They've tried to say, look at what Boris Johnson in Westminster is doing. He can't handle the virus, but we can. But they've fallen flat.
They've been hoisted.
Germany,
You're so right. They've been hoisted.
All those restrictions. Go on.
They've been hoisted by their own petard. They're the ones who've been embarrassed. And those two, the only reason they do all this is because they pursue, they've got this left-wing lust for big state power over freedom of the individual. And it's not working out for them. And good riddance to them. Dominique, great to speak to you. Let's speak again soon.